Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. I'm very good day to Datin, Jannatul, Binti, Ahmad, Kamil. So today we would like to present about virtual visit to the Royal Children's Hospital Melbourne archive. Before we begin, let me introduce myself. My name is Aina Batrisyia binti Rosman. This is my fellow groupmates, which is Fatin, Nabilah binti Razlat, Eazarisha, Husna binti Mohamad, Huzaimi, Imnalovika, Novella, Jamburi, and lastly Nurin, Sabriana binti Mustafa.
Hi, my name is Nurin, Eazarisha, Husna binti Muhammad, Huzaimi. We chose the Royal Children's Hospital archive for our virtual visit project. So here, I would like to present my part, which is the introduction. The Royal Children's Hospital Archive serves as archival hospital that collect and preserve the hospital cultural heritage and unique identity. Archive play a role in supporting activities such as business, education, research, and treatment of patients in hospital. Same goes to the Royal Children's Hospital Archive that play a role in keeping record of its administration, educating their staff and students about the tradition practice at the hospital, providing disclosure of hospital identity to the hospital community, providing support on public affairs, fundraising and campaigns that involve the community, as well as provide service to those who wish to conduct research activities. This situation led to the variety collection of material in the Royal Children's Hospital Archive according to the activity that held over years.
This is the list of activities that involve the Royal Children's Hospital Melbourne archive.
The first activity is acquisition and collection. Acquisition is the process of adding up, making materials into your collection through the procedure of transfer, loan, purchase and donation to the archival institution, meaning that it involves the actual transfer from the original location to the archive facility, which means this process requires a great care in making the transfer. Before beginning with the acquisition process, it is important for the archive facility to understand the aims of archival acquisition activity. This is because the archive or RCH should know and understand about the process. In this case, the Royal Children's Hospital Archive acquire materials by using method of purchase and donation. Purchase method are an expensive practice where is needed to considering this method. This method is usually used when there is a valuable and an essential addition to the archival collection and to the archive, where they can afford the purchase and offer another items. To be more specific, the Royal Children's Hospital would increase their number of collection through purchasing from another public and private organization. They also actively collect new items to connect with the community with the history of their archive. Meanwhile, the second method is donation. As for donation, they usually come from the local citizen, private institution, group, or association. All the donation through the archive will be subject to signed deed of gift, detailing the agreement between two parties. Archive should not accept improper materials and should be based on the archive policy, whereby the donation are accepted from the current or former employees, students, and their patrons only. For the collection is collection of documents of any origin that has been purposely rated based on the subject, form, geographics, scope, or other common characteristics. As for the Royal Children's Hospital EH archive, it holds document, photograph, artifacts spanning of hospital history such as administrative and departmental, and then annual reports, RCH publications such as books, staff personal papers, training materials, photography such as professional or personal collection, film, horror history, staff uniform, pictures, artwork because they have their own gallery, instrument and equipment, and the last one is memorabilia.
Next, what is an appraisal? The appraisal is the process of spreading record with continued worth from those with no further value to discard the latter. The appraisal process also requires archivists to determine the value of records or archive that can be used for future action or for any purpose, as well as the length of time the value of record will continue to exist. In addition, every archive needs to be cautious and selective in its acquisition activity to recognize the collection that is required and compatible with archive legislation. Several objectives are productivity improvement, identify a mistake, promotion opportunities, employee goal setting, and employee deployment. The importance of appraisal is linked to prompt record disposal, that is, destruction and archival prevention, good administration, and balance the disposal of record lifecycle. However, the Royal Children's Hospital never administers record management, does not control or have access to any patient medical records. So, for access and data to patient record had to contact the head invoice service department. This is because all veteran public sector worker and government agency should go with obligatory standard and specification established beneath the authority of the General Public Record Act 1973 for managing the records they produce and receive in their work.
Next is deposit. Deposit refers to a disposal of a records that no longer needed, either by the physical destruction, select files, and transfer the record of enduring value to other archival institution. It also ensures that the record created by the organization, their disposition status, and how long the record that should be kept in the organization to the archive, and when they can be destroyed if temporary. With that, the staff of the Royal Children's Hospital need to take part in this process, and they identifying the records that have the archival value. are also responsible for ensuring that disposal procedures are activate and carried through the correct time. Moreover, disposal activities should be managed with the clear understood of an organization in business process, which the value of the information to the business, and then the legal status retention, including information of equal value under the Public Record Act. And then the third one, technology that support the information.
The third activities in the list is accessioning. Accession is the official procedure of accepting content into archive. It's happened when collection are physically and legally transferred to the archive. Accession offers information needed to keep an accurate, up-to-date inventory of archive and manuscript holdings. Therefore, they can provide a quick reference assistance on newly acquired collection. Archival document can be obtained in whole or part-time by a number of means, including transaction, retention schedules, and legislation. Accession has served as a link between unprocessed and a processed collection. In these activities, archivists will save vital information on the collection, such as author, sources, format, content, and many more. It involves sort of data at the Royal Children's Hospital Melbourne, including patient court transcripts, pharmacological and medication data, patient index, and register. The procedure begins with conduct a preliminary survey by determining the type and location of items. Firstly, staff must identify the collection, donor, and conditions of record before moving to the next one. Box that has been received should be counted and categorize them. The staff must discover the provenance of incoming entrants. This is because provenance is connected to the beginning of anything. Therefore, the staff must conduct a research to learn about the history of records. For existing accession, staff just need to look through the old records to find the necessary series. Secondly, the staff must review the list of materials before accepting the transfer. RCHM involved in many series of research such as sleep apnea, childhood obesity, and cardiovascular disease. The study was conducted by doctor and professor from the hospital or from the different institution. That's why the reports are preserved in the hospital archive. Those reports are preserved in there, hence it must be double-checked to make sure it's genuinely original and not copied by any irresponsible parties. Every material that maintained should be double-checked to identify its year of manufacture, significance, and category. After that, the record will be instantly issued with accession number based on repository numbering system. We have to highlight this part, which is staff must be cautious when selecting materials for accession to ensure the paper are relevant. The third step in this procedure, which is carry out records appraisal process based on standard disposal policy. Appraisal is the process of determining which document may be maintained for a certain period of time or otherwise. It's intended to establish if they have evidentiary value, informative value, or needed. As an example, RCHM website are full with variety of records with this value, such as medical report, photos, and film. Disposal is a schedule that was carried out by staff following by a list that determine which document will be disposed and which will be kept for future reference. There are two types of disposal schedule, which is general record and functional record. RCHM incurs significant costs in the maintenance and storage documents that have no function, ranging from 90% to 95%. The RCHM staff have attended a series of seminars to be trained and gain new skills in this field, as the National Archive of Australia has been conducted a series of seminars for the outsider to learn about the archive system for the country, for that country. The first step that staff must use in this procedure is they must use standard consignment box to pack the materials. Physical records must be packaged in containers that have appropriate for record size and format. This is not only preserve information, but also giving ongoing structure and support. The staff must be cautious not to overpack the records, since it will cause documents to crumple and shred. Paper files such as A4 files or smaller volume need to be packed in the box that 400 mm of length times to 170 of width and 2 times to 245 mm of height. This is a measurement for the box so that it will not be overpacked or less packed. For a larger size, RCHM has to buy a non-standard container from the authorized sellers that have been approved by the National Archive of Australia. Container that cap must not weigh more than 7 kilos because it is safe weight lifting maximum. The last procedure is staff must prepare relevant medium to receive a different format. As we know, RCHM has housed so many types of record, therefore staff must apply simple action of storing, which is similar to standard method of document storage. Not only they get the physical equipment, they also get mentally trained, as the National Archive of Australia has conducted a few programs to get the medical institution in Australia are ready to step up their game in the archive. They also provide suitable storage equipment such as suitable cupboard, containers, so that all the records are kept safely and arranged neatly. When all done in a top notch, they will be more easier for doctors or researchers or study to access into it.
Next is arrangement and description. What is arrangement? Arrangement is the method of analyzing the organization or set of archive so as to higher preserve their cradle and original order. So composition the archive into group, series, and things in order that preserve and reflect that chronology. So, as to function evidence, archive should be reliable, complete, and accurate. Thus, as a rule, The arrangement of archive must reliably reproduce and document the order and process at custom, capture, curate, organize, and maintain the records throughout their primary use for government, business, organization, and individual. So, the Royal Children's Hospital in Melbourne provide outstanding look after Victoria kids and their family for 150 years. The major specialists are Pediatric Hospital in Victoria, subcurrent services as well as Victoria Medical Specialty Rehabilitation Service, Victoria Pediatric Palliative Care Program, Victoria Rhetorical Pediatric Medical Service, and Victorian Hearing Screening Program. So, as you are able to see, there are level of arrangement and outline of Royal Children's Hospital member archive. They are later an example of the arrangement and description. Initial one is insertion for the instant the Royal Children's Hospital member. Next is group as an example is Ministry of Health, and followed by subgroup as an example is medical body.
Hi, Assalamualaikum. My name is Nurin Sabriana and I will talk about preservation and storage in Royal Children's Hospital, Melbourne. Firstly, RCH or Royal Children's Hospital is provide a collections, preservation and storage. It also gives access to produced and collected of records. Furthermore, RCH also preserve and collect the legacy and the special characteristic of the hospital itself. Archives from RCH have a substantial and valuable historical record of a prominent pediatric facility in Australia, and it has 150 years around of images, videos, the innovation of the hospital, and the other records is a part of RCH collection. The archives support different operations in the fields of company, research, education, patient care, as well as to provide research services. Let's move to other slide, which is all the information and details about health issues, patient's name, contact details have been collected by RCH. Every time patients come to the hospital, new information will be added to the records, and they also storing of the patient's personal and medical information is to offer adequate treatment and care. They preserve the records securely in an electronic medical record, or can be called as EMR system. RMH Hospital, Royal Hospital for Children, Peter McCallum Cancer Centre, and the Royal Women's Hospital have shared this EMR system. RMH Health Information Services securely store all the clinical information.
So, moving forward to outreach activities. Outreach activities is the act or practice of visiting and providing service to people who will not have access to those services otherwise. The Royal Children's Hospital's plan is to maintain the high quality of care provided within the hospital while also exploring new avenues to support mental health and well-being outcome for children and young people worldwide. Great care, every place will spread unitedly with patients, their families, our community, and our staff. As a result of their previous strategic plan, they need infuse tutelage into everything they are doing, so as to realize our vision of being a good children's hospital that lead the way. Furthermore, bridging activities are one choice for up access to physician and overall retention at the national level.
Next, we move to the next part of the presentation, which is the SWOT analysis of the Royal Children's Hospital Melbourne. As we can see here, there got three types of strength that RCHM has provide, which is provide the best access, provide unique materials, and connection between community. The firstly is the best access. Why would RCHM has become a best access? Firstly, there are vast materials including documents, birth certificates, and research papers. All these items that for future reference for researchers or students, all included in one roof. Therefore, students does not have to go to many institutions just to collect all the reference for their study. The hospital handle a lot of spectacular cases, so they have better access to primary materials and original document. Like I said before, RCHM has involved in many scientific research, so they have few of specimen that use in the research or in the experiment. Secondly, it provides unique materials. As I said earlier, they have involved in many spectacular cases. So spectacular cases lead to the unique materials because each professor point of view are different and unique. So that's why I see the papers that they write, that preserve in the archive, is very masterpiece because it's write by one of the most great writers in the world of pediatrics. They even published an article in early 90s, which is the parents has blew up as a community reference because at that time, society are not exposed to the real parenting, the real goodness of parenting. Means like they don't know how to burp the baby, they still don't know how to do the CPR to the baby if they choke or something. So the parents of the article that title as the parents help the communities to educate them in that way because at the time they have no technology, right? So it's very crucial for them to read the article. Last but not least, the connection between community. The article that has been wrote in early 90s has changed the community point of view towards the RCHM. As we can see here, RCHM has been conducted so many series of festive that they want to build a really harmony relationship between the society. The more they build the harmony, the more that society will believe in them. Because some people, they still believe in, orthodox. I mean like, the old folks I mean, like when they sick, when they sick or they got fever, just don't need to go to the hospital. Just give them plenty of water, blah 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 blah, and like that. Therefore, when they read the article that title the parents, it's changed their mind. Therefore, that's why I say documents that preserved in this institution are very helpful to virtually everyone in community. Therefore, they do not have to refer manually. As we in the pandemic right now, everything has to be kept online because we don't have access. I mean, like the access to the outside, to the world outside is very tight. So we have to access everything virtually. The festive that usually they organize to build trust with local society are Christmas Eve and Car Sale. So that's all from me. Thank you.
The next one is witnesses. Even though there's a lot of string of the archive website, but at the same time, it also have the witnesses of the archive website. The first witnesses is the lack of online services. This is because currently facing a critical situation, which is pandemic COVID-19. Most of the organization had to close. With that, we can find any information that related to the organization of archive through their official website. Because of that, the user will use the official website of the organization of archive to find any information that they need. The same goes to the Royal Children's Hospital. RCH have provided service about their collection, but it's still only restricted to the basic services only, where they have always been included their archive website. The second weaknesses is limitation in online interaction. This is because the website did not have a chat with us button. Because of that, it can be a problem for the user. For example, if the user wants to give a donation to the archive, but since the website did not have the chat with us button, it might take a lot of time until it's done. The third weakness in effective design. The design of the website is not interactive, where the reason lacks of contrast. This is because the background and the color of the website nearly identical. The website also use a small font size, and that with effective design, it will make who are access to the website will feel bored when they read all the content about their archive.
For the SWOT analysis, my part is 3. EMR or electronic medical record has contained a massive amount of sensitive information about the patient's identity, medical health, and medical history. This EMR record allow physicians, health professionals, and insurance company to share the information. Unfortunately, it is easy for hackers to get all the sensitive information, and it makes EMR is a primary target for a variety of security threats. They all are related with cybersecurity, such as attacks against phishing, ransomware and malware, encrypted blind spots, and cloud chase, and lastly is employees. Firstly, attacks against phishing. It usually arrives by email to get the victim click on the link and make login credentials or to deposit some virus. Healthcare professionals should be trained on how phishing assaults might be identified. These tricks must have overcome with the proper way, which is do not click on the link inside an email, either it makes or has a top-level domain or connected with questionable websites. And the doctor should carefully analyze any EHR request for a file share and make sure the other end is a recognized medical practitioner. Secondly, malware and ransomware. Malware is capable of entering the IT network of the health system, such as download. Phishing is a weakness to software and the encrypted of communications. This type of malware assaults of the health system might vary from the robbery of information through the host computers and networks. For ransomware, is locking users of their computers or system while requiring money institutions for retrieve data and files. Access to EHRs is closed until payment is made in the hospital or healthcare environment, and it is constitute the main ransomware targets for the hospital and clinics. Thirdly is encryption blind spots. Data encryption helps to safeguard data flow between users on-site and external cloud apps. It is very useful to secure an EHR or HER, which is Hospital Electronic Record. However, encrypted blind spots have become an IT concept, which is since hackers now are hiding, avoiding detection and performing their targeted assaults by encrypted blind hosts. That makes it more difficult to track and detect security tools for breach of the EHR or EMR. Encrypted data may be guarded using security measurements to monitor encrypted traffic, find blind spots, and suspicious behavior. And this is a relevance for hospital IT teams to secure health data and patients' privacy. Fourthly is cloud threats. There are more medical organizations are turning to the cloud. It is ensuring that private data are protected, and HIPAA, Health Insurance Portability and Accountability Act of 1996, is becoming increasingly crucial. And the IT hospital teams need to be kept implementation of robust data encryption to guarantee data is safeguarded by moving from network location to the cloud. There are another way to prevent from cloud threats happens, which is select reliable IT partners and vendors that take the necessary steps to reduce the risk, maintaining all HIPAA compliance requirements, understanding what information is in the cloud, allowing no unnecessary or unrestricted access, and creating and maintaining a well-defined and understood cloud use process. Fifthly, employees. Personnel of hospital and other healthcare institutions are one of the dangers to IT health security. Education on cybersecurity. All this has to do with education cybersecurity is do all workers know how to identify phishing and ransomware attacks. They should ensure that the cybersecurity strategy and policy is not only fully understood, but followed and enforced by the patient health organizations. That means they have to educate all the healthcare partners and the staff on healthcare cybersecurity with the best practices and enhance administrative controls, monitoring physical and system access, and creating a workstation uses policies, including privacy filters and workstation capabilities, and auditing and monitoring system users, employing device and media controls, and also applying data encryptions.